Okay, with the temporal bone, you have your temporomandibular joint, which is right in here where the mandible joins with your skull. And then you have this point right here is called the mastoid process. Under here you have another really pointy prominence, which is called the styloid process. And you also have right here, there's a hole right here, which is called your external acoustic meatus, and basically that's your ear canal. Your sphenoid bone has a pointy area at the top, which is called the greater wing, which you can actually also see inside the eye orbit. And inside your eye orbit, there is an opening called the superior orbital fistula, which is an opening for the cranial nerves 3, 4, and 6. Okay, when we look at the inside of the skull, we have the cribriform platform, which is down here below the crista gallia, which is an opening where your olfactory nerves pass through. And then the crista gallia, this protruding part right here, is the point of attachment for the dura mater of your brain. And then again we have the lesser wing and also the greater wing of your sphenoid. We have your internal acoustic meatus, which is this little hole right here. And then we have your optic canal right here. We have right here is the petrous part of the temporal bone, and what that does is it houses the middle and the inner ear canal. We also have the sella turcica right here, which is this little cavity which houses the pituitary gland. Okay, now we have our facial bones. We have the maxilla, which is like your upper lip. We have the nasal bone. We have the zygomatic, which is your cheekbone. We have inside your nose the interior nasal concha. And we also have the vomer, which is the bottom part of your nasal passage right here. Along with the vomer, the top is the perpendicular plate. Those two together join to form your nasal septum. The inferior nasal concha, again, on the side right here, that forms the lateral part of your nasal cavity. The mandible, which is your jawbone, has different parts to it. You've got the body, which is the main part of your jawbone. Then you've got the ramus, which is the long part here that goes up and down. You've got the mandible angle. You've got the mandibular notch, which is the notch right in here. And then we have the mandible condyle, which is the top part right here. We also have the coronoid process, which is the pointy part at the front of your jaw. We have the alveolar process, which runs along the top and also along the bottom, which is where the bones of your maxilla and your mandible join with your teeth. The next part of the axial skeleton is the vertebral column. It comes in different sections. You have the cervical region, which is the first 7. Then you have the thoracic region, which is the next 12. You have the lumbar region, which is the 5 in the bottom small of your back. And then you have the sacrum. And on the sacrum, there's actually 5 vertebrae. But the way the sacrum is different from the rest of the vertebrae is that the 5 bones of the sacrum, the 5 vertebrae, are fused together. And then right here on the bottom, we have the coccyx, which is also known as your tailbone. The atlas, which is your first cervical vertebrae, allows you to nod your head up and down like this. And then we have in your thoracic vertebrae, we have the spiny process, which is the point at which it's the pointy part right in the middle of the back. And then we have the transverse process, which are the 2 pointy parts on the side of the vertebrae. Now the difference between the thoracic and the cervical transverse process is that on the cervical ones, they actually point forward to the anterior part of your body, and the ones in your thoracic part of your vertebrae, they actually point posteriorly towards the back of your body. Also in the vertebrae, we have the body, or the centrum, which is the part that is the solid part in the front of it, which in between each one there are intervertebral discs that help cushion the vertebrae. Now, on the inside of the vertebrae, there's an opening, which is called the intervertebral foramen. And through the intervertebral foramen is where your spinal cord passes through. That way it's all protected by the bones of the vertebrae. The next part of your axial skeleton is your sternum. Now your sternum is broken into parts. You have the